Baby, it's cold outside. Welcome to another episode of What the Health. I'm Janelle Thompson, and today we're going to talk about frostbite. So frostbite is a disorder that occurs when the skin and the tissues freeze because of cold weather. The classification of frostbite is generally determined by how deep into the tissues the freezing occurs. Frostbite can occur when temperatures fall below freezing. The wind can play a role in how quickly frostbite can occur, but the wind does not cause frostbite. The areas that would be more likely to get frostbite would be things that are furthest away from our heart. So tips of our nose, our ears, our toes, our fingertips. If these areas don't have any protection on them at all, if they're not covered, if they're wet, if these areas are compromised already, for example, if you have a vascular disorder or if you're taking a medication that changes the way your circulation works, if you would have contact with surfaces such as the ground, you would be more likely to have the heat pulled away from your body. Maybe you're doing activity where you might be wearing compression stockings or tight-fitting boots, such as ski boots or hunting boots, and that's already constricting some of the circulation to the areas, then that can put you at higher risk. So when the body feels cold temperatures and starts to notice compromise, our body starts to shunt the heat away from the tissues that are furthest from our heart and our core, and these areas start to have limited circulation. The tissues then start to develop crystals in between the cells, and those actually can develop ice crystals in freezing. So when that happens, dehydration occurs between the cells as well. That can lead to frostbite. So what are the symptoms of frostbite? So with frostbite, you'll notice that you start to have burning maybe of the area that's getting compromised by the cold. You may see that it's turning purple, red, then you might see some blotchiness of white, and then most likely you'll start to lose some feeling in the area. But there usually is some process of it feeling quite painful during the first stages before it would go numb. Now, when you go to rewarm that area, you want to rewarm it slowly. Part of the damage that occurs to the tissues is during the rewarming process, the body does release some inflammatory mediating factors that actually can a little bit work against the body. And so when you rewarm this area, it's preferred if you can do it with just some warm water. You want it a little bit above body temperature. It does not rewarm faster if you use really hot water, and as a matter of fact, it's more likely to cause damage and pain if you do so. You don't want to do vigorous rubbing of the area. Remember, we talked about that there are ice crystals that have developed in between the cells, and if you rub those crystals around, that's creating more damage and more inflammation. With the rewarming, how do you know when you've completed the rewarming process? You should have some tingling, some feeling that redevelops. You would also notice that that area should turn red, purple, the white color should leave. After that, then you need to make the decision of, do you seek further medical care? That is your judgment. If it's not feeling like it's really gone back to normal, if you're continuing to have tingling in that area, a few hours afterwards, or if you're not noticing good circulation, you need to be seen for that. The side effects of having frostbite can go on for several months. And depending on the depth of the frostbite, sometimes an area has to be removed because of tissue death and damage that occurs, and that can even occur several months after frostbite has been experienced. So thank you for joining me again for another episode of What the Health. We will see you again next time.